have been visiting different FUM sites where we have ministries. So far, we've been to Belize, we've been to the United States, into Africa. And today, I want to introduce you to Sam, who is the director at Lugulu Friends Mission Hospital. And we are going to begin by allowing him to talk about himself and and for us to get to know him. And at the end of this session, we will be able to ask questions. So if you have a question, please write it down and please remember to ask it at the end of the session. So Sam, please introduce yourself. We want to get to know you. Tell us your name, tell us where you are, tell us what you do, tell us your favorite color, your favorite food. We want to know anything and everything that you want to share with us. So the time is yours, Sam.
How are you all? My name is Samuel Mwana. I'm currently the hospital director, administrator in Lugulu Mission Hospital. I am a health administrator by profession. I've done health services management and with an experience of more than 8 years, having managed several facilities within East Africa, that is in Kenya and part of Congo and South Sudan. So currently in Lugulu, and my favorite color is green and white, preferably. Yeah, so I've also specialized in leadership development and mentorship, and I've also extended into accident prevention and management of accidents, and also analysis when it comes to reporting. Yeah, so that is a summary of my name. I am a family man. I'm married to one female wife. We are blessed with one daughter, and we thank God for that far.
Thank you. Tell us about Lugulu Friends Mission Hospital.
Lugulu Mission Hospital, it has its own history, having been there for more than 100 years. And specifically, I will share since when I joined it. That was last year, October. So this is around my 9th to 10th month there. When I came and joined Lugulu, it was actually in problems, because I found it like it was on its knees, nearly collapsing. So I joined in and we began things from the scratch. And my target was specifically to change the attitude of the staff who have been there. Some of them, most of them, like nearly everyone, had gone for like salary arrears of more than 4 months. So they had stayed for longer period without salaries. So their attitude was not positive towards patient care. And also it had impacted the community negatively, because you could not stand anywhere, even on the streets, and tell people you work with Lugulu. They could easily be irritated because of what the impact it had caused in the community. So my coming there, I began by changing the attitude of the staffs, then also supplementing and implementation of the HMIA system, which was on board, but it was not being utilized by staff. So I also I entered and also spearheaded the issue of financial stability in the organization. We looked in each and every way of making Lugulu survive, in terms of every kind of little coin that can come in within that unstable place and also unstable season. So we managed to bring it on board. And I remember when I joined, we were seeing like 4 patients in a day. That is an outpatient. When we could see 6, it was like a celebration. So we have tried to work much and a lot in uh, community outreaches. We have also enhanced the issue of marketing, healthcare marketing. So we rebranded the tarnished name in the community. We interacted with the community people. We went there, they told us what they wish and what they want Lugulu to be. And we also interacted with staff. They told me their issues, their challenges, their problems, which by the grace of God, I began solving it day by day and also changing their attitude. And God enabled us to at least start raising cash, and we started paying their arrears little by little until we like finished all the arrears. And as at now, like we have paid the salary up to date. So that was the thing that was on the ground. I also found a challenge in infrastructure, but we have done where we can through little support and also much of the effort that we have received from the FUM to ensure that at least Lugulu is being looked upon as a structure that is capable to take care of people, because the outlook is the one that people see first, to be to have that assurance of being at a safe place. So also in the human resource management, we also managed to at least bring staff in line with a positive attitude and bringing back the standards in the healthcare as per the legal and policies of our country. And once the staff got into the line of what we had stipulated, up to today, they are now currently working it to their best. And we are anticipating much more to move Lugulu to another level, God willing. Also, when we came in, issues of equipment was an issue. Like departments were lacking nearly everything. So we started by at least having a good network with stakeholders out there, others who had lost faith in us. They started believing in us after giving them assurance and also after them seeing what had come in after an improvement in terms of how Lugulu looks like, the attitude of the staff. They also gained trust with us, and some of them even began to supply us with some equipment on credit. And up to today, we have managed to equip most of the departments with the new machines. We engaged also in other partners who do free trainings and also offer, like they donate equipment to us, and we have seen it work. So all our departments now, they are moving towards fully being equipped. And also some of the projects that we found, some of them had taken more than 7 years, just stagnating because they lacked something or somebody to give direction. So when I came to Lugulu, I managed to form teams within Lugulu to ensure that they move each and every project that had been stagnant into completion. And so far, we managed a lot of them. Like the new theater is now fully equipped. It was accomplished, and it is currently at work. We have also managed to make like the morgue. Its renovation had been a project that had been stagnant for many years, which we have managed to do it. I also found Lugulu only relying on NHIF, which has currently shifted to SHA, and NHIF was owing Lugulu Mission Hospital more than 24 million, which up to today they haven't paid yet. So, having been relying on only one source of revenue or insurance, it has been a challenge for Lugulu actually to have, sorry, a diversity of sources of funds when it comes to medical services. So, when I landed on the ground, I began an initiative of healthcare marketing and also outsourcing other insurance. Those are medical schemes. And as up to today, we have secured CIC. We have also secured the HR consolidated company, which covers the RAI group of companies, more than 5 companies in Kenya. And we have also secured Jubilee Insurance. We have also secured Equity Insurance Company Limited. So those are just other medical schemes we are trying to ensure that we bring their clients on board so that we can treat them and also have another source of revenue. So once they are fully onboarded and we have clients start working in, it will at least create other avenues for our funds when we treat the patients other than the NHIF, which is currently SHA. Also, when I entered Lugulu, the challenges of SHA came in whereby NHIF was stopped in one day and SHA was put in place. So we managed to be the frontiers within the country to ensure that we were the first hospital to ensure that SHA is working. And also, apart from the challenges we had in mind, we also ensure that things are not making us lag behind. And as a level 4, the government had told us that we will not be having outpatient services. So I took an initiative of boldness and network to write a letter to the CEO of SHA by then. And we were fully recommended and also allowed to see outpatient using that SHA program, the National Insurance Fund that is currently in Kenya. So when I entered Lugulu, there are very many challenges. I found it in problems, and challenges began to enter one by one. Also, there was a challenge with the community. They had some strikes before I came in, and so when they knew there's a new administrator, they came with all their problems and conflicts. So by the grace of God, through the conflict resolution skills that I have had since before, I managed to settle the community, which is now at peace with the hospital, and we are really collaborating very well in terms of relationship. And also, the same thing happened just when Donald Trump, the United States of America president, communicated about issue of the stopped donation of USAID, which brought a great negative impact on facilities in Kenya. And more so in Lugulu being a mission hospital, we have been treating patients on HIV/AIDS and TB based on those donations, which were halted, and thus making also my management team really feel the hardship in running the process and also programs, so as we do not lose the same patient, because we are seeing more than 2,000 patients and they are increasing in number because of the good healthcare services that we have improved in Lugulu. Yeah, so that is so far what I can say. A lot of things have changed in Lugulu. We have managed to bring change and we want to really make things flow. More so, where the part that was worst enough was the financial side, because the reason why Lugulu had gone down is because of the financial mismanagement by not my predecessor, but the other team that were there before my predecessor. So bringing into financial transformation and financial policies to ensure that at least there's proper management of finances. It also took us like 2 to 3 months to ensure that we streamline, having worked on some ghost debts and ghost creditors that were out there. We ensure that we only have accurate and only efficient creditors who are at least within the policy. So we managed to reduce from like creditors from 70 million. We only realized after scrutinizing, we only found that only legal ones were around 40 million shillings that we owe them out there. So we have also worked on the financial audit report, which had been a laggish and also which was problematic in the facility, making it difficult for the management to implement the strategic plan. So we found many things in errors, but so far so good. We have rectified every gaps that we found on the ground, and we now have a proper financial system that is really making Lugulu move from one level to another in terms of management, both financially, HRM, and the processes within. Yeah, that is so far about Lugulu, and we have great and much more hopes. And also, when I came in, I'm an enthusiastic person, and I'm a very innovative and creative person. So I've done a lot of development when it comes to projects and also expansion of Lugulu, however much I found it struggling, the little months I've been there, I've ensured I open a clinic, level 3 clinic in Matili, which is currently working now. We are seeing more than 10 patients per day. And as we work towards the registration process, which may take time until January. So I believe in work and hard work. I believe in teamwork. I believe in positive change in life. And for me, I also believe in speed because I always grasp opportunities immediately they arise. So based on that, we have also signed very many memorandum of association and understanding with very many organizations like the international organization called Upendo, which is a collective of surgeons across the country who do all kinds of surgeries. So we have partnered with them and they are doing their surgeries in Lugulu. That has come in so that we boost our surgeries and also our theater department. And we have also signed an MOU with another surgical center, which is also bringing in patients for just surgical cases. So we are trying to network and ensure that Lugulu comes back and even it surpasses what it used to be, because I am anticipating to make Lugulu level 5 next year. Looking at my history and my experiences, I always I do great things within a short time. So given an opportunity, I can change Lugulu more and even expand it to greater levels, because I also planning to have at least one hospital open at least after 2 years. After each 2 years, we open a hospital. Each 2 years, we open a facility. Whether it's a satellite clinic at Lugulu has just to grow. So I have very many and great plans and visions and ambitions for Lugulu. Support from the staff who are now collaborating with me, support from the hospital management team, support from the board members, that is our Quaker Church, and also support from the FUM. It is something that has given me strength to at least focus on bringing Lugulu to where it is now. Thank you, and less need for clarification.
Does anyone have any questions so far?
Yeah, I'm curious how much was the USAID money that was lost this year? How much had it been a year ago?
Like 2023, they were giving us 24 million. And
Wow.
when I came in 2023, when I came in 2024, I found 19 million. So it
Wow.
reduced to 17 million.
This
And
is,
now,
well, wait, is this shillings or dollars?
no, Kenya shillings.
Shillings. Okay.
Yeah. So then this year, their program is running up to this September. And we have been given a notice of end of contract until they will be further communicating. So based on that, they have also brought in the issue of integration, that now the government of Kenya or facilities like us now, Mission Hospital, should now come in and take charge of that budget, which the George Fox team that visited us saw some of the integration processes that were happening in Lugulu to ensure that at least we absorb the staff. And we look for money to continue buying those drugs. There are some drugs that are supplementing the ARV treatment, which have been stopped so far. So we need to buy again and continue maintaining the services to the patients, because they will still come to Lugulu where they have been served for years.
And what do you use for tuberculosis? Is it isoniazid primarily? Which drugs do you know? For the tuberculosis clinic, what drugs do you use, and what's your budget for the tuberculosis clinic?
For tuberculosis, unless I check from the pharmacy department to be accurately on the specific budget and the exact drug.
Yeah.
Yeah.
Okay, great.
Jane has her hand up.
Mute. Yes, I just wanted to get a sense of the kind of cases you get. So I've heard now about TB and HIV/AIDS, but what is your usual clinical, what are the usual cases that you're faced with, say, in a day? What are people suffering from?
The usual cases are malaria. We being in the western region that is malaria prone. So malaria cases are there. We have the issue of typhoid and also ulcers, arthritis, and also have elective surgeries. Apart from the CS, we have elective surgeries like the lipoma, the ganglion, and orthopedic cases. Being on the highway, many accidents happen. Yeah.
Thank you.
Are traffic accidents fairly common? Collisions on the highway, are they very common?
Yeah, they do come. Even this evening, just before this meeting, I was called. There's a guy who had been run over by a transit good
Oh my.
who has died in our facility, and we were planning how to refer him because he had had breakages of the ribs and the hip, so he needed urgent operations with a group of surgeons.
Oh wow.
Can I ask about maternal care and well baby clinics? Do you do any of that?
Yeah, we do mother to child healthcare clinics, and we also have our maternity wing, which is fully equipped. Recently, we received CPAP machines from the Party Care group after having trained our nurses, and we are also looking forward to more trainings and boost our maternal department. In a year, we can have like 2 to 3 cases of mortality in maternity. So we are really working towards zero, which we have improved. And having minimized such cases, our maternity is one among the best in the region.
Thank you.
Emily's hands are up.
Yes, first I want to thank you very much, both for being present and for giving us a really strong idea of the financial picture and the history and the challenges at Lugulu. I've been very grateful for that depth of information. I have two questions, and the first is very short. Can you say again when you started working at Lugulu?
I started working Lugulu last year, October on 2nd.
Thank you. And then my second question, forgive me for asking again about US aid, but we in the United States have been very worried about this because we know what the potential impact is. What I'm not quite understanding, you said something about the contract continuing through September, but what I'm not clear on is whether it is the case that the funding has completely disappeared to support HIV, AIDS, and tuberculosis, or has only some of it gone away? And do you think it will be possible to make up for this using some other funding? Or is that just, we really don't know at this point? My question, I guess, is this a situation that is very serious, or is this a situation that is so serious that people are at risk of losing their care?
Yeah, the issue is the program is now at uncertainty level because now the little funding that is available for the program is what had been budgeted earlier and released. So they are working on that surplus, and it is ending on September. So beyond which now uncertainty hits it to 100%. Because even as per now, there are some programs which have been not allowed. They have like put into a stop. So they are urging hospital like Lugulu Mission to come in and step in those gaps. Now after September is when we will be told whether they will be coming back or not. Now that brings into an issue of the staff and also brings in the issue of the patient. However, they have informed us that in case they withdraw, as a facility, we should be in place to serve the patients and also retain the staff. So something we are struggling to bring integration into plan. Like now in Lugulu, there are some structures we have demolished that were separately being used by the CCC team, and we are bringing them in unison with our staff. So we are working on HRM integration and also the HMIS system. Currently, we are using two systems, but I had given them 2 weeks so that each doctor, each clinician, each nurse can use our system to generate the report for the CCC. So we are working to ensure that at least we cope up with any challenge that may befall us by September. And that also means we absorb these staff and pay their salaries and ensure the patients are still seen in Lugulu. Now, pertaining if the funding will continue is now where we do not know.
Thank you. And I hope someone has said this to you before, but I'm sorry. Many of us tried very hard and did what we could to stop this from happening, and we weren't able to do it. And I'm very sorry.
It's okay.
We also have a PowerPoint presentation so that you can have an idea of what Lugulu Friends Hospital looks like, especially if you've not visited, or if you have not visited in a long time, you are able to get an idea of the upgrades that have happened there.
So this is Friends Lugulu Mission Hospital. Slide 2, is it slide 2?
Let us know what is happening in these pictures.
Like here, there's ongoing renovation in the CCC that is specifically for the integration. Like we were having 2 pharmacy rooms in Lugulu Mission Hospital, but now when the Donald Trump, President of US, confirmation for the hindrance or alteration of the donor funds for the program, we were forced to merge the departments together so that in case the drugs are not supplied, the facility or Lugulu Mission Hospital can be able to supply those drugs to the patients. So we have been shifted into integration. So we removed the 2 separate pharmacy into one. Now that means we had to demolish some structures and expand the rooms, break down some walls, and make up a large pharmacy that can accommodate the previous 2 pharmacies. That's why you can see the renovations are ongoing. And as we talk now, they are completed, and we are now under one roof as one pharmacy, which is serving both patients of the normal daily patients and also the CCC program patients.
Could you tell us what CCC stands for?
That is Comprehensive Care Center.
Okay, is that an inpatient facility overnight where people stay, 24 hours or weekdays at a time or what?
For that program, it only used to serve the TB cases and all the HIV/AIDS. So they
Oh,
could
okay.
come to clinics and they are given drugs for free and they go home. So all their services were free and funded.
Uh-huh. Oh, wow.
Yeah.
Hmm. Are there more slides?
So when I came to Lugulu, as I talked earlier, we really got it rough from the community because Lugulu having gone down, it is like they really expected a lot from Lugulu, yet it was not helping them. So when I reached on the ground, I had to go to the communities, uh, begin again afresh, engaging them on friendly basis, collaboration and oneness. So we brought in the issue of medical camp, which we were doing them for free, to the vulnerables, for the women groups. We've gone for the children, we've gone for youths. So these are just some of the photos we have done. So far, we have done more than 10 medical camps since I joined Lugulu, and they have yielded a lot. Like in this medical camp, we found women who are sick and they cannot even afford money. So the facility, with the little money we had received from our treatment, we purchased for them drugs, we treat them. And those who are admitted, at times we go and pay their premiums for the SHA. That is the Social Health Insurance Fund, which is currently in Kenya. And they are admitted. After admission, they went back home. And that's how we began now bringing the community back to our facility.
So what does it cost for someone to enroll in SHA?
For someone to run SHA, it depends with the GDP of an individual, because the system asks questions of who you are, what you do. It asks you everything you own in your house. So the more you tell the government about all those things, the more the premiums. So you can find an individual paying 1,000 every month. So that means like 12,000 in a year.
Uh-huh. And is that on the high side or is that a low figure?
That is on a high side.
And what's the range?
The range is between 350 to 1,050
Okay, that's helpful.
a month.
So can in certain cases, can Lugulu pay the enrollment fee for the client and then be able to bill SHA?
Yeah, for all these medical camps, more than 10 we have done, we have been paying for SHA, for those premiums, for those patients we get.
Yeah.
Because some of them, you find them in very poor families, they're even unable to raise even food.
Right.
So we have a program in Lugulu which we began. So we pay the premiums and we treat them on SHA.
Uh, uh. Well, shall we go? Yeah, let's go through the slides.
Now, this is the physiotherapy department. When I came to Lugulu, I was only having two staffs in this department, but they were only having a coach and liniment. So I listened to their need and desire, because when I came in, I also began something we call revenue generation mind per department. Like if you are two staff in this department, how much are you generating at the end of the month? Is what you are generating able to pay you salary and also remain to buy reagents or equipment? So where there were gaps, we ensure that every department is at least doing something. And now the staff understood the reason why they are working. And any little that was coming in, we were paying their arrears. And once we completed the arrears, now the staffs began to believe in us and they really picked it up. So this is a department which was having nothing, and they told me, we have a need in this gap. If you give us a static bike, if you give us a massager, if you bring this infrared and the TINS machine, they told me we have referred this number of patients to other facilities to be done simply because we don't have these machines. So at the end of the month, we squeezed any little amount that had remained after paying salaries, and we have bought reagents and drugs. We squeezed a little bit to bring in machines and equipment one by one, slowly as we manage it. So now the physiotherapy is, I can say it is 60% now equipped, because there are other gaps which are pending once we are done.
And so now you're able to build for more services because you have these machines. Is that correct?
Yeah, now these machines can do more services, and more clients now cannot be referred to other hospitals, but rather they complete their session within the department.
How many? This is Lugulu Hospital is in what city? I'm sorry, I should know.
Pardon?
What's the town? What city is Lugulu in?
In Lugulu.
What?
In Lugulu.
Oh, in Lugulu.
Yes.
How far is that from? I want to say Kinshasa, but that's not right. What's the main town in Western Kenya? Kisumu?
Bungoma, Webuye?
Is Kisumu the main city in Western Kenya?
Yeah, that is where at least aeroplanes land in the airport.
Uh-huh.
Then from Kisumu now you come to Kakamega. Then you pass Kakamega, you come to Webuye.
Uh,
It is
so
like
how far is Lugulu from Kisumu?
it's a 2.5 hour drive.
Okay.
Yeah, but you have a
Is it
private
toward the north or
for a
west?
private vehicle, you can even take 1 hour and 30 minutes.
Uh-huh. Okay. So it's a pretty Lugulu is a pretty small town.
Yeah, a very small town.
And how many hospitals are in Lugulu? Is it just this one?
Now in Lugulu, it is found in a sub-county called Webuye, which is a little bit higher town.
Uh-huh.
So Webuye, it is within, Lugulu is within Webuye, and we have more than 10 hospitals around.
Really?
Yeah.
I was just going to jump in. This is Sean McConaughey. I was going to say that the Lugulu catchment area is enormous.
Uh-huh.
It is a huge, huge catchment area. The population, even though there aren't large towns, cities there, it is a very densely populated area. So Lugulu Hospital is in one of the largest catchment areas in Western.
Okay. Okay. And so there are like 10 or so other hospital facilities within what, 10 kilometers?
Some as near as 3 kilometers.
Uh-huh. Uh-huh.
Yeah.
So the different hospitals have different machines, different services, different physicians. Is that correct?
Yeah.
Uh-huh. Yeah, I guess to really understand it, we would need to know, what other hospital facilities are available in the area and how how Lugulu is integrated with them. I assume that there's no regional medical authority. Is that correct?
Yeah, like when you look at Lugulu, it has some other smaller healthcare centers, which
Mm-hmm.
at least refer patients to it.
Mm-hmm.
But now being a level 4, nearly all the more than 10 hospitals around there also at level 4. So what brings the difference is about the customer care and the kind of equipment and machine the facility has and the kind of specialists that are on the ground.
Mm-hmm.
So we tried as much as possible to ensure that at least Lugulu is equipped with any machine that is needed. It accommodates every kind of specialist that is needed so that most facilities can refer to us. So currently Lugulu, we only refer very critical and maybe very critical and emergency cases to Bungoma, which is a level 5 and a referral in the region.
And how far away is that? Is it Mungoma? Say the word again.
Bungoma,
Bungoma. And how
yeah,
far away is Bungoma?
it's around 35 kilometers.
Okay. Is it toward Kisumu or not?
No, towards Malaba border.
Okay. Okay. Um,
Maybe we could see the rest of the pictures. That would be
yeah,
really
yeah. Let's do that.
Thank you.
This is the Matili Medical Center I was mentioning about having opened a branch. So when SHA came in, it had restricted that a facility must have its smaller healthcare centers, which can only refer to their facility. So it was very difficult for us now to get any feeder, being a mission hospital, and all government facilities were commanded to refer their patients to their other government institutions. So it became a challenge for us, and the only thought that came into my mind was to open a branch which will be able now to refer patients to us. And that's how I came up with this Matili Medical Center, which is now currently doing outreach services as we wait for the registration. This is the new theater, which installation has been done, and now patients can be operated in it. The team that came in Lugulu, they at least visited it when the installation was in plan and in process, but now it is complete. We also celebrated our nurse during the International Nurses Week. This was just as a motivation to our nurses, which went on very well. We celebrated them. We had a come together, a lot of encouragement, lessons and teachings, advice, and also we had a scholarship together with them. And they were very happy. It boosted their morale and hard work. We have also, the slide is about the renovated pediatric ward. When I came to Lugulu, this pediatric ward was very old and not appealing at all. So even parents could not prefer admitting their kids in this ward. So this was a support from the FUM, your support for donations on the amount which I found in the account. If I cannot remember, it was about 1 point something million, which I found on the account when I joined Lugulu, and they were for FUM donations. So they were meant for the renovation of the pediatric ward. So I just quickly picked it and worked on it, and at least made it appealing to our kids. This has boosted the numbers, and children are always happy when they come in. And also students from Lugulu National Girls, when they are sick, they actually prefer being admitted in the other segment of this ward. This is the bulk purchase of the CCC drugs. The George Fox team, when they visited, they had donated us something which specifically went on these drugs to just boost the gaps that have been left by the donor from the USAID, to ensure that at least our patient continue getting the efficiency of what they have been supplied to from the previous years, as part of it goes to the programs. This is the George Fox University team. They visited Lugulu, and I want to say thank you once more for having visited us. We had a great engaging, and we learned a lot through their services. support in funds, and also most of them gave their time, their skills, and a lot and a lot. So these are some of the patients that were supported by the George Fox team while on the ground. When they were on the ground, they saw the need that maybe could not have been identified when they are far. The 4 people on the upper photo, they had got accidents and they needed orthopedic surgeries. So the George Fox team actually gave in funds specifically to purchase the plates, which were done, and this is after they were now okay and ready for discharge. There's another picture down there of a gentleman who was sick due to the burns. So he had been burned, and the George Fox team, the nurses and doctors really attended to him. And the other picture shows how he was discharged, fully clothed and healed, ready to leave. I want to thank the team because through Carla and Louise, they even gave this gentleman a package of 10,000 shillings, which he was very happy when he left with it for upkeep after discharge. Also, when I joined Lugulu, they were having land which was not being utilized, and they're also having a zero grazing unit which was not being taken into seriousness. So I plunged in and ensured that the animals are well catered. I went for more supplements and good feeds, and also ensured they are in a good place. So I found 3 animals, but so far within this short period of there, we have managed to increase their number. They have calved down now. We have a total of 5 heads of cattle. The lower picture shows the calves. All of them are heifers, and now the 2-1. Also on the side of the land, we have now engaged farming on a serious note, and we planted corn, which we are planning to harvest in the next one month. And we have also done other vegetables, which now we are using to feed the patients so that at least we reduce any other costs that may have arisen before. These are the old buildings that need a lot of renovation. So as I work on a few, they are increasing. The more are they that need renovation. So based on my faith and trust upon God, I know most of these buildings will be renovated and at least they look good. My pressing one is the George Fox, not the George Fox, the Ford House, which carries the history of this facility. That is the upper picture in the middle. So I've been thinking about renovating it and making it either a cancer center or make it a corporate outpatient sector within Lugulu Mission Hospital. So those are some of the dreams I have, and through support, the face and the outlook of the facility can really change and be a great place.
Thank you.
So is the proper name of Lugulu Hospital Lugulu Mission Hospital or Lugulu Friends Hospital, or are those equivalent?
It is registered Friends Lugulu Hospital
Friends
with the
Lugulu.
Kenya Medical and Dentist Board, but now the name is Friends Lugulu Mission Hospital because it's a faith-based. So I think
Okay.
somebody who was doing registration missed that mission part.
Sam, can you tell us how we can support you and the ministry of the hospital?
Your support is really, I can say it's really dire in need. I believe in teamwork and networking, support in both spheres of influence, that is knowledge-wise, service-wise and material-wise. I'm not a person who believes in one thing or the other. I believe in the totality of support, because when I remember the George Fox team, when they were on ground, they learned a lot from us and we learned a lot from them. A lot and a lot. And we even thought or preferred if they could stay here for 1 year. And we are praying so that in the near future, support in terms of practitioners, support in terms of material, finances where possible, it will really help us solve some of these biggest and giant problems that are on the ground. Some of them, our hands are tied that they are instructed by the government and there's nothing you can do about it. So it needs really a lot of support. Also, last time we had trainings from the George Fox team, the professionals, the doctors, our nurses and doctors learned a lot through those trainings. So those are supports which my request is if they continue on there frequently so that we become more of one family to really bring this Lugulu where it is needed. Also, I'm a person who loves correction. I will request that as you support us, also be free to advise us, be free to correct us, be free to guide us, because a long journey always is done by one step. And in case of any deficits, we put our heads together and continue trusting upon God and praying that all things work for our goodness.
I assume that the excuse me, the team from George Fox University included some physicians, right? It included medical people from George Fox, the team that came. Is that right?
Yes. So the group of doctors, qualified nurses, and also student nurses.
Could I don't know that they're directly affiliated with FUM. I wonder if we could somehow work with them since they have experience on the ground. Um, I'm on the general board of FUM, and I'm also a physician, and I would be interested in communicating with the George Fox team if you could put me in touch with them.
The full board?
I'm on the full board of FUM, and I am interested in talking to the George Fox University team that came to do the tour.
I can connect you with Sam and we can make the connections to George Fox.
Great. Now I have a question. I understand that when patients at Lugulu cannot pay their bill, that they are kept in the hospital until some significant portion of the bill is paid. That obviously strikes us as strange here, but without really debating the pros and cons of that, do you have a separate place for them to stay when they cannot pay the bill, or do they just sit in the actual hospital ward?
Yeah, currently we try as much as possible to ensure they don't, because also on your support on the donated funds, there's that program of Adopt a Bed, which we also utilize to ensure that they don't fail to pay and also continue staying.
Right.
Then also within Lugulu, we have gone to the community and we have advised any patient who fails to pay. We advise them it's not only money they pay in. So you realize we go beyond what is on board and we allow them also suggest. You realize some of them have trees at home, so they offer to cut trees and supply us as firewood, and we compensate on the bill and they go.
Oh,
For
really?
those who totally fail and they cannot pay, we always engage our social worker who visits their family and know the whereabouts of the family, the capacity, how are they able to raise. And we find some of them cannot really make it. So we waive, actually reach into my office and we waive those bills and we allow them to go. And for a few who commit themselves to pay later, we go and use another policy and program which we also commit them. They go and come back and pay later.
I've talked to
You,
some, go ahead, go ahead.
does any other friend have any questions? We're coming to the top of the hour. We have 5 minutes left.
Well, how do we reach Samuel?
I put my email on the chat at carlaj@fum.org. You can write to me, and I will be happy to put you in touch with Sam.
Okay, great.
I saw somebody asking on chat.
What?
I've seen somebody asking about Chuck. Is there any ongoing connection to Chuck? Yes, there is that connection. We as Lugulu, we are associated with Chuck. Chuck is the Christian Health Association of Kenya, which is actually helping us to channel the mission and faith-based hospitals to the government. Like the last meeting, they were in State House with the president concerning the payment of the SHA claim form. So we are really in connection with them, and they are also supporting us in one way or the other, trainings, and also helping us to do one or two things.
Does anyone else have any questions or comments or anything else that you would like to know?
Yeah, how much funding do you get through FUM currently? Do you know?
It comes in different, like the recent one was 693,900, which we were advised to use 51,400 for adopt a bed, then others to be channeled on the operations. Then previously it was 1.6. That was when the George Fox team came on the ground. So once we receive the amount, there's those guidelines we follow, then we implement what is on the ground as per the need and as per the directives given by the FUM team.
So 1.6 million shillings or what?
Yes, Kenya shilling.
And we will take our last question from Jane. Jane Wright.
Yeah, I just wanted to get a sense of how many nurses do you have? How many, maybe doctors work? Yeah, I was just wondering the number of people that you are working with. Thank you.
Okay, in total, I have 182 staff. 106 are on contract, then 23 are the CCC department, then 23 are on locum. Then I have 16 who are volunteers. Then around 10 student staff. Then I have 7 specialists. These specialists are inclusive of all surgeons, that's orthopedic surgeon, general surgeon, obs gyna, and I have an eye specialist. I also have the ENT specialist. And for the specific number of nurses, like I have 37, more than 37 nurses, clinicians around 9, lab techs around 9. But to have the specific number, I have to utilize the departmental head so that they can at least give me the accurate one. But I have that general perspective of 182, and specifically those contracted, those on a locum, the specialists, like that.
Thank you.
Well, thank you, friends, for joining and getting an idea of Lugulu Friends Mission Hospital.